Hi all, Bob Lindy from the Tradition School of Herbal Studies. One of the things I talked about recently that I get a lot of emails, people asking for herbal advice on particular issues. So I'm trying to make a point to, whenever possible, stop and talk a little bit about those so that we can answer everybody's questions and people can go ahead and reference back to the YouTube page. And really important to us, remember to click on that subscribe button that's right below this picture, because we're hoping that, for all our time and effort that we do to record these in our spare time, that we start to get a little return just from the advertising monies. And please share with your friends. So today, always a controversial subject, and it's one I probably get asked the most: parasites. Everybody's got them, or everybody thinks they've got them, but we actually kind of do in an odd way. Generally, we look at parasites as a particular critter, and I'll define that critter here in a second, that somehow is feeding off of us without our benefit. Although some parasites are really beneficial to us, or it's a symbiotic relationship. There's three general ways that we classify our parasites. We can look at protozoans. Those are microscopic little guys that we don't really see. Oftentimes are in the blood, but can be in other places as well. Then we can look at some of the helminths, which those are the worms, the little squirmy things that frequently show up in our intestines. Then what's sometimes referred to as ectoparasites, ticks and other things that kind of embed into our skin outside of the body. So we can almost say there's ectoparasites and endoparasites. Both are an issue. The ectos tend to hang out for a little while, then bolt, and the endos, they kind of stay in and sometimes can cause some more serious damage. And when we start talking about parasites, there's a lot of discussion as to what's the best way to combat them, what's the best way to detect them. The reality is we're still trying to figure out some of the more obscure ones and things. When we look at the side effects of chronic Lyme disease and so forth, those are protozoan kind of things. That we're still developing those tests to most effectively detect those so that we can treat them either through traditional dominant medicine, through medications, or through herbal care, or ideally, I would say both. So there's probably three primary ways that we can detect them, and some secondary ways that sometimes are used. Blood work is sometimes your basic CBC, CMP. Those are kind of a screening device for us. So we can look and see our eosinophils, that's EOS on your CBC. That can actually be anything from food sensitivities, or if it's really out of range, it's either a serious allergy or it's a parasite that we need to track that down and figure out why it's there. The other thing, if we see some sort of anemia, where the RBCs, the blood values are going down, we don't have a good explanation, either through blood loss or poor diet, or even a long history of anemia, that we can say, oh, there's not a good reason why you're anemic. We chase it down. Sometimes we have to consider that exposure to parasites might be one of those. One of the really common questions I ask a lot of my patients is, any interesting travel, chronic gastrointestinal issues, Montezuma's revenge, travel into the tropical areas, into third world countries, onto farms. Those increase our risk of our exposure to certain intestinal parasites especially. And there's some folks that actually will intentionally infect themselves with parasites. The perfect example of that is hookworm. That some people, for chronic autoimmune disorders, there's something about the hookworm that seems to cause a body's more normalized response to certain autoimmune disorders. So it's always good to know what's going on, and ultimately not everybody needs a hookworm, and it's only in the most extreme cases when other attempts have failed. So when we look for herbal care, trying to deal with parasites, we're looking at those intestinal parasites, but sometimes even our bloodborne parasites. And a couple things are important. We need to know what kind of parasite. There's literally dozens that are common in just the United States here. But when we start to look at tropical or more foreign climes, there's an endless number that we don't normally look for. So we have to find out what kind of critter this is. We have to then learn about its life cycle so that we can properly dose and utilize our herbs for that type of critter. And the biggest problem is people either don't do it for long enough, or they don't catch the babies as they're being hatched, or you do it so long that some of those herbs are a little rough on the body, so we can actually damage the host, that's us, with the herbs that we're using. So some really common ones we look at, some of them are regular food that's part of a normal diet. Garlic, fennel are both excellent choices, and those can be used, in culinary or much higher doses. And there's some very specific protocols that we look at. Wormwood, imagine that. And I would say any of our artemisias, wormwood is part of that artemisia family. Most of them are mildly toxic and can have a real positive benefit when used correctly. Black walnut is another classic that we find here in the U.S. Clove is got a variety of interesting properties to it. Neem out of India is frequently used. Epazote, which is a common weed here in Florida, so we use that a lot. It's very specific for pinworms. And then there's some cool Chinese herbs like shijunzi and kushen that are oftentimes used internally and externally. But then there's some herbs that you don't think about very often. Jamaican dogwood is excellent. It causes paralysis. It's called fish poison herb. So it actually paralyzes the animal, and so that's used in very specific cases. Think about a tapeworm. It actually has these hooks that lock into the intestinal wall. If we don't get that helminth, that worm, to let go before we expel it and kill it, then you're going to have a dead body inside you that doesn't do good things to you. So sometimes we use things like kava kava that causes relaxation. Sometimes we use things like the Jamaican dogwood. And also we look at things that are expellants, things like da huang, which is rhubarb root, or anything that strongly moves the poop out of the body, because we want to expel these parasites if they're in our intestines. And there's other ones that are harder to identify. Morganellas is one that's not understood, not even sure that it exists, and there's not clear-cut approaches. And a new one I just learned about recently, which is ropeworm, that there's a great deal of debate as to whether is that an actual helminth of some type, some sort of worm in the intestinal package, or is that some sort of mucosal plug that's actually coating and over excretion that's being caused by, honestly, poor diet and exposure to toxins? The reality is we always have to work on the individual person, looking at the combination of herbs that will treat both the acute, whether that's an intestinal infection from parasites or a blood infection or liver or so forth, or are we going to create balance so the body's natural immune system starts to take over and correct things? So no matter what kind of parasite you're using, it's important that you actually find out, either through stool samples, blood work, or any other number of different ways, to include ultrasounds and MRIs, to discover exactly what type of parasite you're dealing with. And once we do that, we can create the correct combination of herbs to kill it, get it to release, expel it, and then correct the system if we've caused any damage with some of those strong herbs. And sometimes the correct approach is leave them alone, and sometimes we need to use the dominant medicine, the Western medicine, and take medications, because that's the most effective and safe way. And it's always a little bit different, acute or chronic infection. So make sure, before you start grabbing that parasite cleanse, make sure you find out what you're actually doing, make sure you do it safely, and be careful, and follow up to see whether you are successful. Also remember, if you're on any serious narrow therapeutic margin prescription drugs, using some of these herbs can actually expel your medication, so you're not getting the benefits of those life-saving medications that you need. So this is Bob Lindy talking to you about parasites from the Tradition School of Herbal Studies and Acupuncture and Herbal Therapies in St. Petersburg, Florida. Make sure you subscribe, and I hope you're enjoying all these videos. And if you have any suggestions, feel free to email us at traditionsherbschool@gmail.com. Bye.